Welcome back to the Cable Data Science channel. It's the evening of November 21st, 2020, and I'm getting ready to run my weekly analysis where I try to predict the number of COVID-19 deaths for December 1st, January 1st, February 1st, and March 1st. Okay? But first of all, let's take a look at a couple articles here. This is a CNBC. U.S. reports nearly 200,000 new coronavirus cases as of what date? As more than 1,500 people died daily. Well, this number comes from Johns Hopkins University, and it's based on a 7-day average. Probably not a moving average, but a 7-day average. But even that can be misleading. You know what? Maybe we should add a 7-day average to our number also, just to get a better picture of what's really going on, okay? But the other number I want you to look at is over here. This is University of Washington's Health Metrics and Evaluation Center. This report is updated on November 19th. And they're saying by March 1st, we'll have 470,974 deaths. But I also want you to see this line right here. Deadly deaths is the best indicator of the progression of a pandemic. Not cases, not cumulative deaths, not cumulative cases, and not hospital beds. Only deaths, daily deaths is a measure of a pandemic. So here's a spike back in April. And here's a spike back in August. And here we passed this number. And they're predicting we're going to go past this number. Look, we're not remotely close to this number here. Okay? Where's the panic? Where's the hysteria? All right? So let's now take a look at two reports. Okay, so here's the basic model. This is using New York Times. It's for this number here. Okay? Although the main part of the number comes from the European Center for Disease Prevention and Control. So we're currently at 11.9 million cases and 254,000 deaths and change. So we're currently averaging 152 cases. My average is based for the total data set from the first death up until the present day. That's why mine's lower than that. But I think that's actually a better measurement. Certainly, 7 days just isn't enough. You would think if there's a 21-day incubation period, you would think maybe a 17 or 21-day number would be more useful. So we look at January here, 363,000. The last number for February 1st is 399,000. And the last number for March 1st is 470,000. This is Washington University's numbers. I'm currently predicting 263,000. Excuse me one moment. Okay. 261,000 in 1 week. 1 week and 2 days. Okay. Once again, we're 252,000. And they're projecting 261,000. Well, my range is, so we already passed the first measurement. We have a way to go to the plus 5%. January, I've got 291,000 and change with this range here. February, this range here. And this number, plus or minus 5% there. Again, cases aren't really that useful. because there's no correlation between the number of cases and the number of deaths. But to reach this magic number of 399,000 by February 1st, we got to average 1,982 deaths per day. Okay. Okay. So here's this 981,000 we have to have. Okay. And this is where we're at. Yes, we have some spikes over here, but look at this. We have to make up all this time at some point. We have to have more than 1,982 deaths, okay, per day. More than that. Not just reach it here occasionally. Okay? Now, let's take it the numbers by March 1st. Again, 952,000. We have to average 1,801 to reach 399,000 plus by March 1st. Okay? Here's where we're at. This we have to be on an average. Now, this data, by the way, is the European Center for Disease Prevention and Control's numbers. And they do have a spike back over here, which, as you will see in a moment, does not occur with Johns Hopkins data. Let's do this. Here's Johns Hopkins number. Now, New York Times data, total cumulative cases, again, 11.9 million. Total cumulative deaths, 252,000. So it's actually a little lower than the other number. So which one do you want to use? It makes no difference to me. 252,000. Now, we saw this. But in order to reach this number by February 1st, okay, we had to average 982,000. Okay? Trouble is, this is where we're at. This is where we have to be. You know, this looks to me if this is already starting to trend back down a little bit. We have to average this number, 982 cases per day, in order to reach 399,000 by February 1st. Okay? Now let's look at March 1st. The numbers are not quite as much, but you can see here, 982, 952, same average. The average has to be 433 to reach 399,000 by March 1st. Here we got a spike up here, but that's only 1, 2, 3 days. Okay? So now, okay. So that takes care of my models for the week of Saturday, November 22nd. Hope you did find some encouragement in here that we're still beating the averages here, which is what matters. So thanks so much for your time. We'll catch you on the next report.